Hello everyone, welcome to RAAONLINE. I'm Dr. Abhinaya. I'm a consultant pediatrician. So we are dealing with the chapter on infectious diseases. So this discussion is going to be on cholera and Campylobacter. So let's start with cholera first. So cholera, we all know it is a dehydrating diarrheal disease. Dehydration, not a simple dehydration but a severe form of dehydration. If not treated promptly, it may lead to fatality and high degree of mortality follows cholera. So cholera occurs most often as an outbreak, epidemics. And once an epidemic ends, it then circulates, the organism circulates in that particular locality as endemic. So it is a disease which is highly prone to producing outbreaks. So cholera is a gram-negative comma-shaped bacillus. So whenever you are asked a question on any infectious diseases, because I have seen the question papers on infectious diseases, most often it starts with the diagnosis of the particular disease or how do you manage. But whenever you start writing your theory papers, you can start with what type of, just give a short intro of what the organism is. So a short note on pathogenesis, how the clinical manifestations actually do occur, and then go on to your diagnosis and management. Okay. So cholera is a gram-negative comma-shaped bacillus, and based on the antigen, that is based on this somatic O antigen, we divide cholera into many serotypes. Okay, so there are more than 200 serogroups of Vibrio, but only certain serogroups, that is O1, O139, they have been associated with epidemics in the past. Okay. Some rare Vibrio cholera serotypes like O75 and O141 have also caused small outbreaks, not pandemics. There is one more antigen which is the flagellar H antigen. This is not used for species identification. So this is a simple classification of Vibrio cholera. So based on the somatic O antigen, we divide into O1 and O139. So this O1 and O139 are the ones which are associated with major pandemics, right? And further division of this O1 type is possible. It is divided as a classical O1 type and an LTOR, Vibrio cholera O1 LTOR. So these are all subdivisions of Vibrio cholerae O1, and this each biotype of Vibrio cholera can be further subdivided into Inaba, Ogawa and Hikojima. So these are all based on the antigenic determinants that each serotype possesses. So we don't want to go in that detail. What you want to know is, what you want to remember is, O1 and O139 are the ones which are major contributory organisms for pandemics and epidemics, and Vibrio cholera O1 is further divided into classical and LTOR subtypes. So the first 6 cholera pandemics that occurred in the world and in the Indian subcontinent is associated with classical O1, whereas the 7th pandemic was associated with O1 LTOR type. So the after outbreaks, what happens? Cholera becomes endemic in that particular locality. So in the current situation, more than 90% of the cholera cases reside in Africa. So let's talk more about the epidemiology of Vibrio cholera. So humans are the only known host for Vibrio cholera, and this organism thrives best in salty water, mostly in salty water, but it can also survive in fresh water if the nutrient levels are high. The transmission occurs predominantly whenever we are talking about this foodborne and waterborne illnesses like Salmonella, Shigella, Campylobacter, cholera, etc. So most often it is because of consumption of contaminated food or contaminated water. In cholera, it is mostly due to consumption of contaminated water, and since this organism thrives best in salty water, whenever the patient ingests undercooked fishes, especially shellfish, because it thrives best in salty water. So ingestion of undercooked shellfish can also result in cholera. Why all these are important? From a clinical point of view, whenever you have a patient with an acute gastroenteritis, you ask a detailed history. What did the patient have? How was their dietary pattern just before the disease onset? So what all the patient had? So was there any undercooked meat, just water, or any restaurant food, any food outside, that is especially from the street vendor? How about any shellfish or fish ingestion? So the type of foods ingested, where from. So all this history is very important for us in the treatment point of view as well. Okay, so now the Vibrio cholera mostly causes diseases in children less than 2 years old. Risk factors for cholera will be blood group O. We don't know the exact mechanism. So the one is blood group O. Next is decreased gastric acidity, because that is the high amount of acid in the gastric, or the acidic content will actually inactivate the organism. So whenever there is a decreased gastric acidity, these organisms will survive and then it will go into the intestinal epithelium, invades the intestinal epithelium and then start secreting the cholera toxin. Next is malnourishment, immunocompromised states and absence of prior exposure. That's why cholera is most often seen in children very young age, that is less than 2 years old.